Hello, my name is Emily or Dr. Stanworth. I'm the Aesthetic Practitioner at Salon, and I'm here to talk about thread lifts. So thread lift is a non-surgical facelift which uses something called PDO threads or polydioxanone threads in the face in order to pull, lift and tighten the skin. It's especially useful for any kind of sagging in this area, the jowls, the nasolabials, the marionettes. As we age, obviously we get this kind of descend of the tissues downward, and we get this excess tissues that collect in this area here with this downward movement of tissue. Now there are some treatments that can help this, progressively over time. For example, a little bit of filler, especially in the mid-face, can help to kind of lift that bit up. But it will get to the point where eventually the aging has surpassed the amount of times that we can do this, and that filler won't have that much of an impact anymore. And then we have to kind of look at additional things such as thread lifts. Or you can have thread lifts even without having any filler at all. I've had a thread lift before in the past, just to know what it's felt like and help tighten some of the jawline area. So it's a really, really good way to use the tissues down here to lift back up. There is nothing else in the aesthetic department like it in terms of lifting capacity. The alternative things that you can go on to having is obviously a surgical procedure, which is a surgical facelift. This is still a non-surgical facelift, and it uses these resorbable sutures or threads, and that are placed deep within the skin and are pulled together and tightened off together, which then lifts the skin up. Now, depending on how much lift that we need, depends on how many threads we're going to be putting in. There are normally two entry points, one on the cheekbone here and then one just before the ear here, and then the threads are inserted in a bidirectional manner and then pulled and tightened together. The process actually takes only about 20 minutes, but to get you numbed up and comfortable, we book the procedure for about an hour, hour and a half, just so you can get nice and comfortable and you can get some numbing cream on, numbing actually anesthetic to work within the skin as well to make sure that it's completely comfortable for you. The threads are then placed in these two areas, and then they will have a plaster on afterwards, which needs to remain until the following day. So it's one of those procedures that I would definitely say, look at your social calendar, look at kind of when you can put threads into your diary, because it's not going to be one of those cases. It's not like fillers where you could probably go back out the next day. You want to just make sure that you're not doing anything in terms of important social engagements, because how tight the threads are to begin with. You want to avoid excessively smiling. Any dental treatment for 6 weeks must be avoided. Any over yawning, so you have to stifle your yawns for the first couple of weeks, just while the threads are super tight to begin with. After that one, they do bed in really nicely, and they do heal really nicely, and you can go about your daily lives and big wide smiles. But for the first couple of weeks, do take precautions. You don't want to over pull those threads. So similarly, sometimes you'll need some Botox before you have any thread lift, just to counteract any pulling against the threads. For example, if you have really strong platysma muscles here, which are a pulling muscle, which pulls downward, these muscles here, it's a really thin sheet of muscle. It's a depressor muscle, and it actually pulls the tissue down. So that if that's quite strong, you will need the Botox to just relax those muscles before you do the threads, just so there's no excessive pull on the threads. Same again with the eyebrows. If you're using the thread lift to lift the eyebrows, which you can do an eyebrow lift, or you can do a fox eye lift as well. You will need Botox in the forehead just to stop that pulling against the thread, because that's going to make the thread disappear a lot more quickly than what we'd like to have. So in general, the threads will stay for about a year. They do fully dissolve. And these types of threads have actually been in surgery and been used for over 30 years. So this is nothing new. It is just that we've now revolutionized it, and we've brought it to the aesthetic department, and now we're using it to our advantage. So the threads dissolve within a year, but actually the whole point of it is to create that collagen and create that scaffold within the face in order to lift them. So even though the threads are gone, the actual results will last for about 2 years. Obviously you will age within that time, but the results, you know, are uncomparable to anything that we offer in terms of fillers, in terms of Botox. The results are just, you know, outstanding in my opinion. And I'm sure the results will speak for yourself. So if you do experience it yourself, or you can have a look at some photos before and afters that we do. It has been done worldwide. This type of threads that I am using at the moment is a specific thread. It has come from Sweden, a Swedish company, and I've chosen them because they are, in my opinion, the safest way of delivering the threads. So there's various different ways that you can put the threads into the face. The traditional way is using a needle, which you know, in terms of safety, you would want to move towards something that perhaps doesn't cause as much bruising, doesn't cause as much trauma, doesn't cause as much swelling. So the method that I'm using at the moment is via a cannula, which is a blunt tube. It's like a blunt needle, doesn't cut through the skin. So the only actual entry points for skin insertion is just by those entry points. The rest of the way through it is through this blunt tip cannula. And that means that we're having a lot less bruising, a lot less trauma, less swelling, because these threads go all the way across the face. Now, traditionally, you know, people would still have these threads, but they would have a lot of bruising associated with these threads. But now with this technique that I'm using, it's called V-Soft Lift. I am in awe of this company because they have made this delivery system which is so much safer, so much more effective in terms of putting the threads in together. So I'm very, very happy with it, very, very happy with the results. So I hope you are too.